any tenderness in their borders. I want to do the next, the range of motion of your neck. Can you do what I'm doing? Flexion, up is extension, hyperextension to your ears, lateral bending, and rotation. Okay. I want to go ahead and look at the trachea. Looks to be midline of the neck. Looks good. We'll check the trapezius muscle. Lift your shoulders up. Don't let me push them down. Good. Push your head against my hand. SCM is good. Cranial nerve 11, spinal accessory is intact. And to do a thyroid assessment, turn this side my hands around here, identify landmarks, the thyroid cartilage, the cricoid cartilage, the isthmus. Displace the trachea to the opposite side of where I want to assess. Have her take a sip of water and feel for any masses. And if there's any tenderness or nodules, masses noted, I would auscultate those areas, the thyroid. I want to go ahead and assess the posterior chest. You can go ahead and stand up for me. I'd just be assessing the skin, noting that it's nice and pink, any lesions, and I'd also be looking for any anatomical deformities. I'm going to go ahead and check for firmness. You say 99 every time I touch you. Let's go turn this way.
99, 99, 99, 99, 99.
Good. Take a deep breath each time I touch you. I'm going to listen to your lungs. Good. Just go ahead and turn around for me. Just assess the anterior chest, the skin, making sure it was nice and clean. No lesions noted, pink in color. Go ahead and listen to your lungs. Take a deep breath. Turn this way so I can see. Take a deep breath. Next, I'm going to go ahead and palpate the lymph nodes. Go ahead and put this on my shoulder. A little bit looser here. Straight up is the central. Out to the side is lateral. Towards the back, behind the scapula, is posterior. Towards the front, behind the pec, is anterior. Okay. For a breast exam, we'll continue to that. Each month you need to do this after the week after your menstrual cycle. You'll be looking in the mirror. You want to put your hands to your side. You can be looking in the mirror at your breasts, on your hips. Lean forward, okay, and above your head. If you're looking for any dimpling or anything like that, go ahead and lay down. We'll continue with the breast exam. We'll put this pillow behind your shoulder. Lift this up. You're going to press onto the tissue and feel for any dimpling or any I'm going blank. Any masses or anything like that. And you just start on the one side, go up and down like that, perfect, and come straight across. As you come across, you go up and down until you get to the middle of the chest. Okay? At this point, we'll go ahead and For JVD, you do 35 to 40 degrees. Find the highest point of JVD on the neck. Come to the, find the angle of Louis. Perpendicular from the highest point of JVD over to the angle of Louis is the measurement for JVD. Next, I want to identify the cardiac areas. Landmarks that we need to assess. We're going to come down underneath the clavicle is the second intercostal, underneath there into the second intercostal space under the clavicle is aortic. Come across to the left second iliac intercostal space is pulmonic. Come down to the third and you're in herbs. Come down to third and fourth and you're in tricuspid. And come over, or come down to the fourth and fifth, and you're in tricuspid, and then over left midclavicular line, and you're in the mitral. I would want to lift. I want to feel for all those areas, feeling for any lifts, heaves, or thrills. I want to go ahead and auscultate all of those areas with both the bell and the diaphragm. Aortic. Pulmonic. Herbs. Tricuspid, and mitral. I'm just going to listen here for a few minutes. I have a regular rhythm and heart rate of 64. And then I'm going to do the same thing again, the other side. Listen to each area. Aortic, pulmonic, herbs, tricuspid, and mitral. Go ahead and percuss. Listen to the abdomen. Right upper quadrant. Left upper quadrant. Left lower quadrant. And right lower quadrant. Listen for any bruits. Right renal, aortic, and left renal, iliac, and right iliac. Next, we're going to percuss each area, each quadrant. Okay. Percuss for the liver, coming down, coming up, and then for the spleen, come over here and work my way down. Okay. Next, I'm going to do light palpation of the abdomen, each quadrant, and then deep palpation. I'm going to go ahead and assess for the liver. Feel underneath the rib. Take a deep breath. Okay. And for the spleen, under and up. Okay, good. Check range of motion of the hips. For the hips, we'll do up is flexion, extension, abduction, adduction, and bend your knee for me. This is external rotation and internal rotation. Okay. For the knee, we're going to do flexion and extension. For the ankle, we want to do plantar flexion, dorsiflexion, and we want to do inversion and eversion. Next, I want to do the strength, lift against my hand and push against my hand. Good. I want to palpate your pulses. We have temporal, here and here. We have carotid, one side and then the other. Brachial, radial, on both sides, radial, brachial, the two femorals, posterior tibial, and dorsalis pedis. Dorsalis pedis, posterior tibial. Okay. Go ahead and put this on. Next, I want to describe the assessment of the male genitalia. You would assess the skin of the penis and the scrotum. You would know any lesions, abnormalities of that sort. Look at the location of the meatus. Make sure that it's midline. We would slightly squeeze the glands to see if there's any discharge, and note that when you look at the scrotum, note that the left testicle is lower than the right. And then to see also for the penis if they are circumcised or not. The next thing that we would want to look at when we actually do the assessment, the physical palpation assessment, the patient would stand in front of the practitioner would sit in front. For the testicles, you would grab the left and then the right, either way. You would palpate the testicle and the epipotamus, and you would assess the size, any nodules, tenderness, and then for a hernia assessment, we would take the finger up the inguinal canal next to the scrotum, up the inguinal canal, palpate the go ahead and palpate the external inguinal ring, have the patient bear down and feel for any bulges or masses. For the prostate exam, we would have the patient lean over against the table on their forearms, slightly bent over. The practitioner would be from behind. They would have their hands gloved, lubricate the finger, and have the patient bear down. That's when you insert the finger. You use the pad of your finger and put that towards the anterior portion of the body, towards the umbilicus, and sweep the finger carefully across the prostate and note the size, the shape, any nodules or any masses like that. You want to identify the lateral borders, and then you go ahead and assess for any nodules or masses. And that's it.